Welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board-certified dermatologist. Along with being a dermatologist and the host of this podcast, I am also the president of the San Francisco Dermatological Society, which is composed of dermatologists who practice in the San Francisco Bay Area. Every year, we hold our annual SF Derm meeting, and this year we gathered our guests at the Ritz-Carlton in Half Moon Bay. From engaging sessions to incredible food and even a round of golf, SF Derm 2024 was a huge success. Continue listening to hear thought-provoking conversations from our incredible dermatologists who presented on matters that answer your dermatology questions, align with our goals, and provide insight to the future of dermatology.
These are truncated replays from our original recorded sessions. Join us next year to get the full impact of the SF Derm experience.
Dr. Akhil Wadhera, who is a dermatologist with Kaiser Permanente and where he's been working since 2005. He's the regional director for laser services and the chief of cosmetic dermatology at KP Northern California. He did his medical and dermatology training at UC Davis and did a fellowship in lasers, and he's going to be talking with us about lasers in the management of HS.
Thank you, Haley. So thank you, Haley, for including me for this panel and all the exceptional work you've been leading along with my colleagues today. Thank you to all of you for coming here today. I get to talk about two of my passions, lasers and HS, and ability to combine them. I've been very fortunate to be at a laser center that we built recently that is completely dedicated to use of lasers for medically indicated skin conditions. And so I'll share some of the things that we do. No conflict of interest, except I work for Kaiser Permanente. I'm one of the 9,300 physicians who takes care of 4.5 million members in Northern California. HS is the lowest quality of life of any skin condition. It's a huge financial burden, not just for the patient, but for the institutions. Many of you may not know the cost of the biologic, for example, high-dose Humira, is about $70,000, used to be at least. Now we have Amjevita and others. It's $70,000 per year over year, non-remittive. And then there's a lot of opportunity to improve care. So let's jump into laser hair removal. By the way, this year marks the 30th anniversary of the first paper published out of MGH, Rox Anderson, and Melanie Grossman, who were two great dermatologists. One of them is a great dermatologist. One, recently passed away, unfortunately. But dermatologists have been leading this work, and I see Ilt in the corner there, the phenomenal work that their group did to bring this therapy to light. So my journey into lasers for HS came from this patient about 15 years ago when Humira was available, although not FDA approved. We were using it off-label. We ended up treating this patient in our cosmetic clinic, and I've sort of transcribed it so you can read it quickly. But basically, he had been treated with everything on Humira, and nothing had worked as well as the laser hair removal. Now, granted, this was N1, but it really, because where this letter came from, from his heart, it really made an impact on me. And I said, well, let's look at it. Let's push the boundaries of what we can do with laser hair removal in a system like ours, where I erred on the asking for forgiveness than permission, and start doing this. So what are the advantages of laser hair removal? It's great for mild to moderate disease. Many studies have already told us that. Patients absolutely love it. It's significantly well tolerated, no lab testing, no going to every month picking up a biologic at a pharmacy. We talked about the etiology of being folliculocentric. So if you can eliminate the hair follicles, you actually may prevent the disease. And so that was really attractive to me of being able to not have it progress. I mean, Dan talked about the new definition of medical control. That is what we're trying to do. And that it definitely reduces the economic burden, not just on the patients, but also on institutions. So here's the mechanism of action. It's hair removal or any other laser that we do is due to selective photothermolysis, where we can target a certain chromophore, and different lasers target different things. In this case, the ND-YAG laser that we use targets the pigment, or the Alexandrite laser we use targets the pigment, but when we double pulse, we're targeting inflammation by targeting the water. And we treat it just like hair removal we're doing as a cosmetic treatment. And our goal when we started looking at these patients was to prevent recurrences. And it was not to remove all the hair, even though patients love it. And they want us to push to do laser hair removal. We go, no. As long as your disease is controlled, we call it a day. Again, this for the dermatologists in the room, and we love to see these slides. And again, credit goes to Ilse group and Henry Ford, who did this, I think in 2011. This was a study looking at ND-YAG, what happens to the individual lesions. And you can see as we go from A, B, and C, the inflammation of the hair follicle resolves with a fibrosis and a complete lack of inflammation. So that's what we're seeing clinically. These were the first few papers published out of Henry Ford that kind of brought this to light. There's plenty of evidence. Our guidelines include laser hair removal. So if you did it, you're kind of in the realm of doing the right thing. There's pretty good evidence. We've had a few randomized controlled trials. And so once I started doing it, we said, okay, let's, 5 years passed by, and we said, let's look at our data. What does it match what other studies have reported? And around that time, the Pioneer trials had come out with a high score of, the 50 that Haley talked about. Most of these new biologics give us a high score about 50, and we wanted to see, hey, where are we doing in laser hair removal? Are we getting similar numbers? And so we did a retrospective single center cohort study. It's one of the largest ones because we had 92 patients. We're trying to get it published. An age range between 14 and 71. My oldest patient that we did laser hair removal was 71 years old. The treatments were done by 2 nurses, and we looked, I'm going to skip this because a lot of numbers. I think here's where the money is. Most of the patients actually had moderate to severe disease. So usually people think of laser hair removal to be used in mild to moderate. We actually took all comers. And what we found was most of our patients had Hurley 2 or Hurley stage 3 disease. So 81% of our patients had moderate to severe disease, which is what we're trying to help our patients with because there's not much available. And then the treatments, we didn't cap our treatments. We treated them as long as they were getting better. If we stopped treatment if we didn't see any improvement, but if they were improving, we kept treating. So some of the patients had 22 treatments. What we found looking back, and me and one of my colleagues actually looked back at all the pictures, and we were taking pictures and to calculate the high score, and we found 70% of the patients improved, had achieved high score, which is much higher than what the biologics do, but obviously this was not a retrospective controlled trial, so it's kind of. But what we found was there were other studies that were giving the exact same numbers. So here are some pictures of Hurley stage 1 and 2 patients who got improved, and these were patients who were already on biologics. So there were some of these patients had been on biologics. Humira was the only one that was available, FDA approved. We're already on it a couple years and not improving. And as soon as we added laser hair removal, they were just, it really changed. So in conclusion, LHR, I would say, is being recognized as an important treatment option for treatment of HS. And we hope that, talking about it at these meetings and other meetings that you go to, I've talked about this at the HS meeting. I've talked about this at the ASLMS meeting because, derms have been the leaders in developing lasers. And we want to continue to use the latest technology in helping our HS patients. And it's already not that latest anymore. I mean, like I said, I think Ilse group first published in 2009. Extremely gratifying for a patient, for a staff. Our staff loves these patients because they, for the first time, they're seeing these HS patients coming back and saying, "Oh my God, thank you so much for doing this," and they want to continue doing it. There was a recent meta-analysis published this year, actually, in ASLMS that looked at all the studies. So if people are interested, that's a great resource to go look at. I think it looked at 10 different studies and came up with the same thing, that it's very beneficial. So I think if you have this device, I mean, 1 million people are being treated with laser hair removal across for cosmetic reasons. I think adding a few HS patients to that practice, I think it's a game changer. I just want to close by some pearls. I think I&D is not that great. I think this is, you probably have heard that already. There's a 100% recurrence rate. LHR improves HS not only by removing future causes of HS, but also we can double pulse them and improve the current lesion. So that's been a real game changer for us. And there's no specific settings. I think they've evolved. So we use similar settings that our staff uses for other things. And then here, I just want to say for the deroofing, Dan did a phenomenal job, but just second intention, you have to try second intention healing. It heals really, really well. Not just in the armpits. We have done it in the groin area. We've done it in other places. It really works. And then acknowledging our HS patients, HS teams. HS Foundation has a lot of great resources. Haley, of course. Drew Saylor, who I think Dan talked about, I watched a grand round 3 years ago before I started doing this, and I saw grand rounds from UCSF, and I was like, wow, can we do this? And we started doing it, and now 3 years later, I get to talk about it. And then I also work with Chris Saeed at UNC Chapel Hill. So thank you.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.